All right. Hello, everybody. Welcome to summer 2021. Hopefully, I don't even know if we're going to have the COVID asterisk next to our summer stuff this year. It might be back to full on just normal years, which is nice. I hope everyone's doing well. For those of you who do not or have not already, if you can turn on your cameras so we have equitable distribution of embarrassment across everybody. And I would appreciate that. Thank you very much. Welcome to, what are we? Assessment Practicum Summer 2021. We have a smattering of people kind of all over the place for this class. We have some diagnosticians. We have some people who are on the cusp of graduation. We have some people who are not just getting started, but in between just getting started and being veterans, in between year 1 and year 2. I don't think we have anyone in their first semester in this class. No, so we're all seasoned in some way, shape, or form, which is good. This class is a fun opportunity to do a number of different things. It's a practicum and assessment, but it's kind of like a catch-all of questions and answers and talking about some things that many of you have kind of seen over the years. And this is an opportunity to dive in a little bit more. So we talk a little bit more about graphing, we talk about analysis, we talk about decision making, all the things that people have touched on in different areas and been able to dive into maybe within a class, but have then gone out and experienced in maybe some different ways than what you saw in your classes before. This is where we kind of come back and are able to revisit a lot of those things in totality. For those who are in the Ed Diagnostician program, we try to have not secondary or supplementary projects, but we try and put try to write the projects in such a way so that you have opportunities to be playing with tools and working with tools that are much more applicable to general ed diagnostician versus just the LCAR. In the past, I've had, which is obviously going to be the focus for a lot of what we do. In the past, I've had ed diagnosticians who choose to go more of an ed diag route for this course, and I've had ed diagnosticians who have tried to, not tried, but have very successfully taken the opportunity to dive deeper into the LCAR and see how that can be used from an ed diag tool. So there's a lot of different options in this course. I realized that I did not post the syllabus yet. I have it right here. But there's still a couple of things that I want to change up. So I'll get that posted after class tonight. I apologize about that. But it's really a grab bag class with a lot of opportunity for discussion, for clarification, for making it what you guys not necessarily want it to be, but need it to be in terms of assessment and diagnosis. Okay. So that's kind of where we stand. Some logistics before we get started. The course is an AB course. It's broken up into weekly modules. Each week we'll kind of tackle a new topic for discussion. But in terms of activities and your practicum hours, Selena, I know you sent me a few emails about that. we'll kind of be following up with the same types of projects throughout the semester. So I'm not looking for specific requirements to get out of each and every one of you in terms of the data that you're taking or who you're working with or how many kids. I'm very, very flexible in terms of what kind of content you're going to be turning in, okay? So Selena, after today, we can probably revisit some of your questions and get you what you need in that short period of time where you know you have kids. And if you know there's an opportunity for you to go somewhere else and experience something different over maybe in July, then we'll take advantage of that as well. Okay. So week-long modules, some consistent activities, particularly for those who are in clinic and in schools for as long as we possibly can. The content wise, we typically go to week 6 or 7, and then the last couple of weeks will be graph shares and talking about some data and assessments and doing a little wrap up over those last couple of weeks. There's a final evaluative project on assessment overall. There are some templates in there, so we'll worry about that a little bit later, but it's a pretty self-explanatory class. It's really relaxed. It's you know, it'll be, like I said, what we need it to be on a week by week basis. Okay. Any questions? I know that was like super vague, but any burning questions or concerns before we dive into anything? All right, cool. Okay, class time wise, classes are typically going to be at 5 o'clock on Tuesdays, not this 4:30. So we start a little bit earlier today. I need to leave right at 5:30 today for a Max charter school meeting that I'm going to at 6 tonight. But typically our class will be from 5 to 6. Schedule change in late June doesn't affect you guys, so that will be straightforward. No class the week after the 4th, I believe. I can't even remember, no. So what days of the week is the 4th?
4th is a Sunday.
4th is a Sunday? That doesn't really help. I can't remember. We'll figure that out when we get closer with what our course schedule looks like there. Okay. All right. So let's start off by going around, do some brief introductions, and I want you guys, so what program you are, where you are in the program, where you're currently working or located, and what kind of experience your current placement has given you with educational assessments in general, whether it's criterion reference, norm reference, whatever it's going to be, what your current placement experience is with assessment. Okay, so those are the questions on the table. I'll go around in an order that makes sense on my Zoom. Allison, you're up first. You're the upper left.
All right. I'm Allison. I am a special ed teacher at Napoleonville Primary School. Just finished my 6th year. I got my master's in ed leadership in 2017. Now I'm back getting ed diagnostician, hopefully finishing this summer. So I'm the resource teacher at my school. So this past year I had 9 students with significant disabilities. I guess with assessment, I've helped with evaluations and like classroom tests and benchmark testing and progress monitoring, and I'm sure lots more state assessments.
Have you been Have you worked on any of the diagnostic testing yet? Have you been able to experience any of that?
Not yet, so I would like to
Yeah,
focus more this summer on that.
for sure. All right, good, 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 good. Selena.
All right. I work for the Terrebonne Parish Schools 504 department. It's just me and one other person. So I help the schools with 504 stuff in general, from new 504 chairpersons to like we do characteristics of a reading disability, characteristics of a math disability. I do assessments, like I do the TILs, if you know what that one is, for the secondary schools, because they are not trained to do that assessment, so they can request it and I go do that. And then I also do behavior for any child. Like the schools will request for me to go and observe and make recommendations. And usually the place that I start, if they are a SPED child, I'll start with the eval and then help the teachers maybe put some of the recommendations in place. And sometimes they don't even know what the evaluation says. So that is something that I work with the teachers with. Even sometimes SPED teachers don't know what the eval says. So I work a lot with like lots and lots of different things.
When you're talking about behavior assessments, are you doing FBAs or are you, yeah, okay.
Yes.
All right, cool. All right, Cece.
Yes, hi. So I'm with St. Tammany Parish. I'm in a high school setting, and my role has evolved through the years with the district. So I mainly work with students with emotional disabilities and provide behavior support. Many children who are diagnosed or have a classification of autism. The cognitive levels can range from low functioning to high functioning. Similar to Selena, I'm working with assessments. I do benchmarks to help our district in the SPED area, FBA's behavior plans, and we work collaboratively with our administration and our SPED department and our SPED team of teachers. I do SLT, of course, our SLTs, and then our progress reports. We also added additional learning opportunities this year that we had to provide from our COVID year from 2019. So we had some additional learning opportunities for our students to take advantage of. And normally that would come in the form of like Achieve 3000 or Moby Max that we would provide for them for the summer. And this year going into 21, 22, they want me as an inclusion teacher working with our students with emotional needs in the general ed setting or resource, but I'll also have my behavior support study skills students, which can range anywhere from about 21 to 25 total. And then this summer, hopefully I will have the opportunity I'm working on now with our district to work with some students who are nonverbal, who are going to summer school, the ESY program. So
Got you all over the place.
I'm looking forward to earning the master's degree so we can sort of funnel me into one, good area. That would be nice. Thanks, Dr. Shannon.
Yeah, no kidding. I hope that comes to fruition for you, because it's hard to do any one of those jobs well, let alone all 5 or 6 of them. So good on you. All right, Katie.
Hi, I am in Southern California. I'm going through the HID program with the ABA option. So for my position at work, I am a supervisor in this school district. So right now I'm doing a lot of initial assessments and FBAs and BIPs and all that type of stuff.
Excellent. All right, Rianne.
Sorry, I had to unmute. So I am out of New Orleans. I work at what's called T-Cord. as Tulane Center for Autism Related Disorders. I've been here for about 6 months now, and so I'm still kind of a little new, but not too much. And where I am in the program, I'm in the ABA program, and I'm pretty much like, I'll be graduating in December, so I would say like I'm a senior. I don't know, yeah, I would say senior. I'll take that.
Yep.
And assessment wise, here anyways, I've done a couple things at my former clinic, but since I've been here, I've done some observing responses through the LCOR, as well as what was mentioned earlier about the FBAs, things like that. So yeah, good to meet everybody.
What assessments did you work with at your previous placements?
We did a lot of VB-MAP, PEAK, things like that. We were very big in PEAK, so we did a lot of PEAK stuff.
Good, good. All right, we'll be talking about all of those. Awesome. Tammy.
Hey, I am out of Baton Rouge. I guess I'm considered a senior too. I graduate in like December, same as the last person that spoke. I'm getting my master's with the concentration in the HID program. I am a line therapist at Behavioral Intervention Group. So basically we just work with kids diagnosed with, sorry, my dog is like, if y'all see this. We work with kids with autism or behavioral disorders. And it's like assessment wise, I'm very familiar with the LCAR, the PEAK, the VB-MAP. Those are primarily the forms of assessment that we use on the daily just to implement behavioral plans. I'm so sorry. Behavioral plans or implement like the programs that are necessary. So yeah.
Cool. Awesome. Thank you very much. And last but not least, Heather.
Hi, I'm in the ABA program. I am working at Touchstone ABA in Homa. I've been here for quite a while. I am in the fall, I'll be going into my 3rd semester. I should graduate in May of next year. And as far as assessment wise, I have, prior to the LCAR was a CPERC, but now we specifically use the LCAR for assessing. I also have some experience with AIL. And the biggest group I have experience in is higher levels of verbal behavior, but more recently I have been dispersed into lower levels, which is a lot of learning for me. But it's definitely interesting. But yeah.
And you're in a position where kind of over the next year or so, you're going to get a lot of exposure to different forms of assessment than you've typically worked with. You're going to be going through an FBA process and FA for the first time, really like intensely. You're going to be doing VB stuff. So this is for you in particular. And CC, you have some more school experience than Heather does, but for behavioral assessments, this is like a launching point for you guys, and whereas everyone else is kind of like in this culminating experience. So
I'm definitely excited. I just moved into an assistant BCABA apprentice position, and I'm working under 2 LBAs, so it helps because they both have different levels of verbal behavior they work with. So seeing it from both ends is definitely helping out too.
Awesome. That's great. All right. And Caitlin, I know you just hopped on. Just kind of introduce yourself, let everyone know where you are, what kind of placement you're in. And the question is what experience you have with educational assessments overall, specifically related to where you're at and what you're doing.
Okay. Can y'all hear me?
Yeah.
Okay. My computer's acting all kinds of crazy. That's why I was late. Experience. So I've been a line tech for 2 years. I work at Milestones. They're branched out of Lake Charles, but we just opened a clinic in Jennings, and that's where I live. So I'm the only lead tech there. Worked with all kinds of kids. Some kids are just using PECS books. Some are just learning to use PECS books, while we have a 12-year-old that can talk in full sentences and is in school. So I've also been in the school setting too before I transferred to the Jennings location. And for assessments, I've had a little bit of experience with LCOR. Our clinic doesn't really use it too much. But our Lake Charles location had just started getting into it. I'm a little familiar with the ABLES, with the VB map. I feel there's probably another one I can't think of right now.
Do you guys use the peak at all?
Peak, yes.
Okay.
Mhm.
All right. Excellent. Excellent. All right. And Molly, welcome. I don't know if she can hear us yet. I don't see a microphone by her. We'll get Molly when she gets all set up. Well, this is great. I think that we're going to be able to review, we're going to be able to touch on so many different experiences that some of you have worked on, that others of you are nowhere near thinking about. And through these experiences and what you guys will be able to share with each other, we're going to be able to really expand, I think, in a much broader way than I've been able to in the past, with different types of assessment, why we use different types of assessments, pros and cons. And hopefully when we get to a point where we're sharing some data, we're going to be seeing some things that at least parts of this group don't see on a day-to-day basis. So while, you know, I want to be able to give you each experiences, hands-on experiences that differ from what you have typically done in the past, I think there's also going to be opportunity for each of you to do some of the things that you are more familiar with, hone those skills, and then expand everyone else's experience through your own presentation. So I think that we're going to be able to touch on a lot of different things that, just a wider range of ideas than I've been able to in the past in this course, which I love. Molly, I think you're fully with us now. Yeah, can you hear us? Nope, you're still muted.
I'm from work. We're good.
There you go. Okay, really quick, introduce yourself. Let everyone know where you are in the program, where you're working, and what your experience through your placement is with educational assessment.
So I'm Molly. I am graduating in the fall. I work at Big in Baton Rouge, and I'm with the 5 and 6 year olds right now. What was the last you said about the? What was the last thing?
What experience do you have with assessment at Big?
Okay, so we pretty much everything comes from the LCAR. So, but I think I've gotten more experience moving into the older classroom rather than working with the younger kids. I didn't have a lot of exposure to the LCAR, but I mean, everything we do pretty much comes from. So we use it pretty often, daily. It looks kind of, I think, harder than it is. Once you kind of like read through it, it's a lot more simple.
Good. I would agree with that for sure. All right, awesome. So before we jump into anything crazy, I want you guys to share with each other, or I want to talk a little bit about what the purpose of assessment is. But you know, anytime we start off any of these classes, we have to start with a little thought experiment of why are we here talking about this topic? Why is this important? What are, and then hopefully diving into what some of the nuances are between all the different things that we have discussed. We're going to start to get into some of the technical terminology that starts to delineate, you know, LCAR from ADOS, from WISC, from this, from that, and why we have these different types of assessments. And then from there, as we progress through the semester, we'll start to look at what each of these different assessments kind of offers with a little bit more specificity, and how we can use each of these to maybe not specific assessments, but general types of assessments to inform practice, inform our decision making, and go off from there. Okay. So, why is assessment important? Why are we here talking about this now? What is assessment? Let's start even with that. What is assessment? Someone be brave.
I will.
Excellent.
Assessment is seeing where the child is and getting a baseline to see, or it could be assessing what you've taught
Okay.
to see it, that they've learned it.
Okay.
And it's important because it drives instruction of how they can be taught. And
so I love that, like, that was just, kind of the word vomit into the universe about what assessment is. And you're like, it's a before, it's an after, and it's a during, right? So you basically just said assessment is all of education. And I agree. I totally agree with that. But just the enormity of that is, it's like people gloss over that to such a huge degree, right? And I'm already, I'm going to prevent myself from getting on top of my soapbox, 20 minutes into this class. But like that's it, right? Assessment is everything. It's before, it's during, it's after, and we have to understand it, and we don't, right? We do not use assessment in a meaningful way some of the time. I'm not going to say everyone, I'm not going to say all the time, but that issue definitely presents itself. Good. What else?
Yeah, so in our educational setting, can y'all hear me, or yeah?
It's a little muffled, but yeah.
Maybe to add on or to build on. So we're familiar with, I'm familiar with the formative and summative assessments.
Okay.
And in the Achieve 3000, we learn about the students' lexile reading levels. So it's pretty cool. I didn't really see that come to light until honestly this week, when we had to analyze our students' reading levels by their pre-test lexile level. And then we were able to get their post-test reading level. But assessments, I'm starting to really see myself, and I've been a teacher, the seriousness and the importance of them, and how, like Allison was saying, they really help guide lesson planning. So
Good. I like that, well, first of all, the formative summative, I think that those are important words that we need to latch on to. And for, we're pretty evenly split here between like a school team and a clinic team. And I think those two words for the school team are going to make a ton of sense. For the clinic team, the formative and summative those are not typically words that we work with, but they're concepts that we definitely work with. Our formative assessment is going to be our moment-to-moment data. It can be a pre and post test for a program. It's going to be what allows us to understand where our students are right now in the moment. Our summative assessment is our pre and post LCAR. It's our looking at our authorization periods. It's those bigger pictures of measuring growth over time. So while the language is a little bit different, those concepts are there. And I think that the value in behavior analysis in particular, there's a ton of value placed on the formative assessment. There's a ton of value placed on the smaller data, the micro data, And I don't want to say that there's less value placed on the summative data, but making a decision based on percentage of LCAR or PEAK or ABLES or VBMAP goals completed, like those aren't the type of I'm going to say it, meaningful decisions that we make, right? We're more interested and care more about the where do I go next right now type of data. And in the school setting, it's not totally the opposite, but there's definitely more of an emphasis placed on the summative data, right? We want to know, did you get there by the end of the year, right? Did we meet the goal? And in the school setting, when you start looking at pacing charts and long-term curricula and state testing, there's a little bit more, for better or worse, there's a little bit more okay with shortcomings on formative assessment. I don't want to say like, there's more, you're more okay with a lesser formative assessment so long as it informs your instruction for how to go next. But is it proceed with caution? Is it move full steam ahead? The data that we get from formative assessment, typically speaking, in the educational setting, is not as refined as what we get in the clinical setting. However, the big picture decisions that schools make from summative data, and we're talking about full-scale changing of schedules and classes and moving teachers, and like there are these massive decisions that are made based on summative data in school settings that we really don't see in clinical settings. So while both use the same concepts and philosophies, they use them in very, very different ways. So that's something that we can unpack a little bit later. Good. What else? What else is assessment? Why is it important?
I kind of work on the flip side, I guess. I work in the area where we decide what assessments the schools are going to actually use.
Ooh, fun.
Which has been tough when it's unfunded. So got to try to find free stuff, which you can find free things, but the norms are what's difficult. I think a lot of stuff is going out on update with the norms as far as that goes. But, I just work with, 504 plans. And so we use assessment to determine the child's level, if they're so far behind or if they could use additional services through 504. And we try to help the schools to determine what they need to do, if they need to do a SPED evaluation, just like troubleshooting, I guess, like if a child's not been successful for a certain amount of time, we help the schools to decide what they should do next.
You're kind of in a really interesting position that I feel is kind of hybrid to what everyone is doing here. So it sounds like you typically are given a number of different assessments and you have to kind of aggregate the data, which is something that our clinicians are very much used to. But the types of decisions that you're making from that are like whole scale curriculum decisions and not the minute decisions that our clinicians are used to, but rather the, what curriculum do we go to? How do we structure the child's day, which is much more of those school-based decisions that we were talking about before. Is that accurate to what you do?
Sometimes it's all different kind of things. It's most of it I insert myself into just because I see a lot of kids who I work mostly with the secondary level. And then, my assigned job responsibility is to do manifestations for 504 students. That's my actual job assignment.
Gotcha.
So I'll have kids that, they've been failing every year since kindergarten, and you can't even fail kindergarten, but somehow they manage to do it. So, and then they might just be 504 for ADHD. They might have tests read aloud. They might not. So it's kind of, looking at, is there other contributing factors to why the child may have been recommended for expulsion? Unfortunately, a lot of the times it's too late because the child, once they get put up for expulsion, the parents might decide not to send them back to school anymore. So then you really can't move any further. So I'm really working in the district to try and look for warning signs that a student may be showing that they could be one of those students that fall into that boat, and trying to provide services or different types of assessments to try and see what we can do, if anything, to help the child be more successful.
So how much of your job previously has been reactionary as opposed to proactive? It sounds like that's kind of switching. Is that?
That's because that's me doing that.
Good.
It is all, like, my assigned job is being reactive to the recommended expulsion, but I'm not happy with that. So I take it upon myself to go talk to district supervisors and try to convince them to see it my way, I guess you could call it, and to try and do things differently. So, but they're coming around. They're agreeing to some things. They think my ideas are good ideas, and they want to see how it's going to play out. But the reason why I'm in the ed diagnostician program is because last year it's crazy the way they do funding and stuff like that. But Terrebonne Parish had some UIR discipline money, so they advertised for this position, but I didn't know that that's what it was when I took it. So my job is, I guess, year by year. So that's why I'm getting the ed diagnostician certification to switch to be an ed diagnostician at the end of next school year, because I likely won't have my current position. So I don't really know where that's going to leave the district in the first place.
All you people in clinics can listen to all these teachers talking about the 15 different roles that they've played in the last 4 years, and enjoy the stability of BCBA for sure. But no, I think that that's really, really interesting. And I actually want to use that as a jumping off point to a similar question in a little bit of a different way. And this goes to a little bit of what Allison was talking about before as well. I'm going to put out 2 terms, and I want you guys to tell me the difference or how you see these 2 terms: test and assessment. Test and assessment. Are those the same? Are those different? If they're different, how are they different? What do those 2 terms mean to you guys?
The way I kind of look at it is like assessment is to see what level or like the baseline or where the child is at, versus like a test. I think of like when I was in high school and I took tests, and it's more of like a how productive was their teaching style, not how much did I kind of like learn or where am I at, but how well did they teach me almost.
Okay, cool.
I see it more can be used interchangeably. Like but there are many different types of tests and there's many different types of assessments, but like you could use the term.
Okay.
The same.
All right.
I think it kind of depends on what you're looking at. mainly because I'm thinking of assessments as preference assessments, but also as behavioral assessments. And whenever I think of test, it's more of kind of like a post probe, I guess, to learning something that they've learned.
Okay. Good. Rianne, you've unmuted a couple of times.
I know. Sorry. I kind of agree with what she just said about the test. Like, it's kind of like looking at, okay, what have you retained from what we taught you? In assessments, like you were saying earlier, it's kind of like looking at before, during, and after. Maybe like interventions have been put in place and things like that.
Good.
So
It's interesting watching each of your faces as you're thinking of these responses, because I can see that, you know, if we look up the dictionary definition of test and assessment, they're going to be synonyms, right? And Allison, I think you're feeling that, right? But there's this sense of difference, and articulating that I think is a challenge, because we talk about tests as being given. We talk about assessments as teachers, and this, we have to analyze the assessment. Cece, go ahead.
Oh, sorry, Dr. Shaman.
No.
Well, thank you. What I guess came to mind is tests were would we be measuring maybe objectives, like it's an actual product, or it's an actual archive, or that's measuring the short-term or long-term objectives of what and then the assessment like would be before, during, and post.
Okay, yeah, and y'all are kind of dancing around the same ideas, and which is great. I'm going to key in on something that Katie said, and I'm going to propose this definition to you guys. So Katie, when you said, when I think of tests, I think of what I did in high school, right? And that's where I'm coming from too. And when I think of a test, I think of something that was given to me. And the purpose of a test to me was to get a grade, right? And that function ended there. Assessment, though, is bigger. Assessment has this instructive feedback built into it, whether it's for students or teachers or administrators or diagnosticians. We do something with an assessment. A test, to me, and Heather, I like the way that you started to phrase this, but I think that that there was still some subjectivity in it, understandably and reasonably so. But to me, a test is a static measure of where a student is at a moment in time.
That's good.
It's a static measure. So I just want to know what you know, whether it's what you know coming in pretest form, what you know at the very end in summative form, or what you know kind of in the middle endish in formative form. But the test stands alone as this measure in time. Assessment, to me, is much more analogous to learn units. Assessment is this interplay between assessor and assessee. If you are asking questions, forget format, forget typography, but if you are asking questions without the intention of analysis, that to me is a test. If the answers to those questions do not provide analyzable data, those are test questions. If I can or give myself the option of doing any sort of analysis based on those questions, that's assessment. So as you guys are talking about tests and trying to find where to split the hairs, I think you're thinking of that in a more topographical sense. What does a test look like? What does an assessment look like? But I want to challenge you to think of those two things in terms of function, in functional terms. What do we do with the data? What do we do with the questions? What do we do with the answers as determining whether something is a test or an assessment? Ed diagnosticians are really, really comfortable with that definition of assessment because you don't care whether or not the child gets the thing right or wrong. You care about the aggregate so you can give a diagnosis, so you can prescribe an educational plan. That whole thing, educational diagnostician assessments, is based on analysis and function. In the teaching world, there are absolutely, in the classroom world, I should say, there are absolutely tests. There are absolutely moments where we ask a question, we give a piece of paper with some questions on it, we give a project, and we don't do anything with it. It's just performed. But there are also times where we ask questions with the explicit need to, okay, how are these students responding? How are these students responding? How are these students responding? All right, if you got it right, go over here. If you got it wrong, go over here. If you were kind of in the middle, go over here. Now we have our groups. Now I'm going to teach you this way and you this way and you this way. That is in the moment assessment. That's not a test. That's assessment. I don't care about the grade. I care about making an instructional decision. In the clinical world, same type of thing. If you present an antecedent and don't take data or don't do anything with those data, the data don't aggregate into anything else, you're just seeing where the student is. But as soon as you put yourself in a position to make a decision based off of that, you're now assessing the child, right? One of the knocks on by administrators who are not as comfortable or familiar with ABA, especially in the school system, when they go into a classroom and they see a behavior analyst who's got their clipboard and they're taking data and they're writing down all the questions they ask and they're graphing everything, they say, stop, why are you assessing all the time? And those administrators, I think, are conflating those two concepts. I'm not going to say those two terms, but those two concepts. They think that we're testing all the time. Do you know this? 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 They're not thinking, they're thinking, where's the instruction? What they're not seeing is that every moment is an assessment and instruction and a decision and an assessment and instruction and a decision, so on and so on and so on and so on, right? So test versus assessment is not a topographical distinction, because I do think anything that is a test could be an assessment, and anything that is an assessment could be a test. It's how do we work with them functionally? Assessment allows us, or assessment is the process of making educational decisions based on data. I think it's as simple as that. But it has to be that decision-making process that defines the form, the actual thing that you are doing. So while we are very clearly going to be talking about assessment throughout the semester, I think it's very, very important that we understand what it is that is going to define what an assessment is. And being able to think of it in those terms should allow us to see that everything that's been mentioned so far, peaks, enables, and this and that, those all have the potential to be an assessment, but they are not assessment by default. Are we there? There we go. They become assessments based on our behavior as the teacher, the clinician, the diagnostician, the assessor. Does that concept make sense? Does that fit with something that you can put in jive with what you do? Good. So all of that being said, why is assessment important? Allison mentioned pre and post, but what I guess the now loaded question becomes, what are the decisions that we make based on assessment? Lots of them. Did I cut out? Right here. What are so the question is, last question for the day, what are some of the decisions that we can make based on assessment? What does assessment give us?
Can you hear me?
Yeah.
I think assessments kind of shows what to teach and how to teach it, because it's depending on what we're assessing, what's the best strategy to use or best tactic to use to teach the particular student.
Excellent. I really, really appreciate that you went there first, because the obvious is still, even when we're talking about decisions, it's, what the student knows, what the student doesn't know, right? But the fact that you went directly to a teacher perspective and how we instruct, how we change, I think is so valuable. Nice job. What else? Good.
I think as a diagnostician one day, I'll be making the decisions on what their exceptionality is and what their IEP is going to look like and their program at school is going to look like.
Absolutely. And we're going to get into some of the differences between norm reference and criterions reference assessments, and the types of decisions you get from a norm reference assessment are so different than the types of decisions you get from a criterion reference assessment, because the norm reference, the diagnostic, kind of gives you a black and white. You're this or you're that, you're here or you're there, right? But then what you do with that, it's not changing your own behavior per se, the way that an assessment has the ability to change a teacher behavior. You're not going to say, oh man, this kid was diagnosed ADHD, I better do something different next time, right? That's not what we're looking for. But rather this programmatic decision, like that's a big decision that you can get based on those norm reference tests. Good, or assessments, sorry. I 10 years later, I still interchange those two accidentally. Good. What else?
I feel like
so we have how to teach, what to teach. We have what types of programs to put in place for a child based on a diagnosis. And sorry, whoever's talking next, hold on one second. Allison, one of the things that I would caution you is saying that the label is a decision, right? Because the behaviors define the label, right? That's not so much of a subjective decision. Not that there isn't subjectivity in some of those diagnoses, but it's given the behaviors that I saw that create the label, what do I do with that? Right? All right, Cece.
Oh, I feel like it's a plan to help write a plan or plans, and then like it's a roadmap. I feel like well, in my mind, I'm kind of visualizing a roadmap to a plan. So
good, yeah, and I really like the school team chiming in here, because those decisions are so different than the clinical decisions that you make from assessment, right? Like where the IEP goes is probably the closest thing, but curriculum and hours and minutes and all these types of decisions are totally different than what we see at that clinical level. Good. Molly.
Oh yeah, so like you can also see like if they're missing, they might not have the prerequisites for that, whatever you're assessing them for. So like you see, okay, if they don't have this, and like you can go a step down. So they might not have the prerequisites for the assessment that you're assessing for. That's what we
Good.
see a lot of times.
Yeah, absolutely. And now when we get to that instructional level decision making, those are not decisions that you can make from tests, right? That static moment in time. You have to look for patterns. You have to look for a series of behaviors in order to start to determine they're mixing these two up. They keep answering this type of question wrong. There's a lot more color in an assessment, an assessment question than you're going to get from a test question. And that assessment question is going to give you the ability to answer that kind of richer or make that richer decision. Good. So what we should be seeing is that assessments take many different forms. We see that the results of assessments take many different forms. How we respond to those, the types of decisions we make, how our behavior as assessor changes based on the assessment that we are giving is what is going to define the presence or absence of an assessment itself. And that's the big picture. That's the 10,000 foot view here, is that there is so much that can be assessment, but it's up to us to do something with it. And if we don't, then we've lost that meaning, that depth, that richness of this critical educational tool without having even discussed before, during, and after, really, in terms of knowledge, student knowledge. There's so much more to it than that we really want to make sure that we are keying in on. All right, I'm going to leave it there for today. I still have some things that I want to kind of move around and massage a little bit for Moodle, especially knowing where everyone is now. So wait a day or two before you start jumping in to week 1 activities. I'll send an email out to the group once it's fully in good shape. I'm going to, especially for those in the school settings, I'm going to put kind of like a secondary channel of activities that you guys can go through. You will be absolutely able to go through some of the clinical, more traditional ABA activities instead of, but I want to be able to give you guys that option. Okay. So, and if anything doesn't really fit with where you are or what you want to be focusing on, reach out to me. We can meet via Zoom. Selena, that might be a good thing, especially given your timeline, so that we can meet and figure out what's going to be as meaningful as possible to each of you. Okay. All right, sounds good. Next week, 5 o'clock, not 4:30, 5 o'clock. All right. All right. Have a good one, guys.